Hello, I'm Femi OK. This is Inside Africa, your weekly look at life and issues on the continent. In the show today, we mark World AIDS Day by looking at the heavy toll the virus has taken around Africa, but also the positive impact of treatment and prevention programs in the fight against this terrible disease.
We've seen a massive mobilization to provide treatment to the millions who need it, and we've seen remarkable progress made in that regard.
AIDS experts are reporting progress in many parts of Africa. Antiretroviral drug programs in countries like Rwanda, Botswana and South Africa have slowed the spread of the disease and now allow many people who are infected with it to live virtually normal lives. But South Africa still has more than 5 million HIV cases, the most in the world, and about 900 South Africans die of AIDS every day. Infection rates are even higher in the countryside. Robyn Curnow visited a rural community where death is everywhere.
These 3 little boys eating a packet of chips we gave them are the loneliest children we've ever seen. Left to fend for themselves, almost forgotten, after their mother and aunt died of AIDS earlier this year and their elder brother was killed in a train accident last month. None of them know what's happened to their fathers. 14-year-old Lindani tells us, "We just sit. Sometimes we work." His youngest brother, 4-year-old Mzamo, is HIV positive. He cries a lot. So too does Lindani, who seems traumatized, shell-shocked. Of the 3 brothers, 6-year-old Nkosiyapa seems the most carefree. He sometimes does more than just sit or work. He loves to draw in the sand outside their home. It's in areas like this that the true horror of the epidemic reveals itself. People living in this valley say that no one has been spared and that nearly every single household has been affected by HIV/AIDS. Mavis Mtembu is a community health worker hired by an international organisation who walks these hills going door to door and sees the full scale of the epidemic.
Hey, I think out of 100, 70% is HIV. 70% is HIV here.
Mavis Mtembu says 12 other children under the age of 12 live alone, AIDS orphans like the Mbambo boys in this community. She says she tries to keep an eye on them. Once with her own money she took little Mzamo to the clinic 20 kilometers away, hoping to get him onto antiretroviral drugs. She says the clinic refused, saying the child needed to be sicker before he could qualify for life-saving therapy.
He's not getting the right food, right treatment. No one takes him to the doctor. If I'm not here or Mrs. Gumede is not here, nobody looks after him.
Mrs. Gumede is a neighbour and she pops in sometimes to check on the boys. But she's got her own grandchildren to look after. 2 of her own children died of AIDS. Grandmothers across this valley are shouldering the burden of the epidemic. Christina Mkize relies on this small vegetable patch to feed her 11 grandchildren and foster children, all orphaned by AIDS, like 13-year-old Nomfundo. Mrs. Mkize tells me all those who suffer come to me. I've accepted that, but it makes me sick and stresses me out. I can't sleep at night. She's 77 and her eyesight is going, so she gets the children to read to her from the Bible. Small comfort for a family made up of those left behind. The young and the very old are trying to hold together this community, says Mavis.
I think there's no future, the way I see it. No future. Because people are dying, people are sick, and people are still going to die in this area.
Death, it seems, is these children's only companion. The fresh graves of their family members reminding them that HIV/AIDS has already stolen their childhood and perhaps also their future. Robyn Curnow, CNN, in Kanini, KwaZulu-Natal, South Africa.
That's a really tough story to watch, but perhaps we have some good news coming up. Earlier this month, the UN AIDS Agency cut its estimate of worldwide HIV infections. New data suggests about 33 million people are HIV positive, compared to an estimated 40 million, according to the old figures. The report includes steep cuts in infection rates for both India and Nigeria. And despite what appears to have been a major mistake collecting HIV statistics, health advocates warn that the fight against AIDS still requires more money and a sustained effort. Dr. Ernest Darko launched one of Africa's most successful HIV/AIDS programs in Botswana 6 years ago. He's now based in South Africa and heads his own company called Broadreach Healthcare. When we spoke earlier this week, Dr. Darko talked about dramatic progress in Africa's approach to HIV and AIDS.
We are truly living in exciting times regarding the response to this epidemic. Of just a few years ago, I'd say, and by 2002, 2003, it was at that particular point, things seemed rather bleak, given that most African countries were not even truly conceiving of what it would take to offer treatment for people on HIV with antiretroviral therapy. However, since then, we've seen a massive mobilization to provide treatment to the millions who need it, and we've seen remarkable progress made in that regard. So even though the challenge still looms large, the progress is finally beginning to show some impact.
Are we really looking at leadership, quality of leadership that makes a difference with fighting HIV/AIDS? Let's take, for instance, Botswana, where you did a lot of work. It was the president of Botswana that really helped the program to take off. Tell me more about that.
President Festus Mogae, I believe, is an absolute hero in the fight against HIV, because Botswana was the first country, prior to there being a change, in fact, in the policy position about treatment, that took the courageous step of deciding to provide free antiretroviral treatment to all its nationals who would be in need of antiretroviral therapy. And in Botswana, in a very short period of time, I'd say in less than 3 years, they were already at a point where they were treating probably over 50% of the people who needed treatment and seeing progress on the prevention side. And as we sit today, they're probably treating about 90% of the people who need to be on treatment for antiretroviral therapy, and more or less have brought to a halt the mortality from HIV/AIDS.
Where else in Africa are countries seeing some success or drop in the rate of HIV infections?
In Malawi, in Zambia, in Lesotho. Now, this is despite the fact that the numbers still remain daunting, and in some cases we're still seeing increases in the number of people being infected. However, that said, these efforts in these countries are making significant ground. Most of these countries started providing treatment not much more than 2 years ago. So really, 24 months is a very short period of time when you're addressing an epidemic that has taken decades to basically mature. I think with the efforts we're putting in towards addressing HIV now, we won't see all of the benefit immediately, but I think in the next 10 years, we'll see tremendous uptake in treatment, and also I think with the new re-emphasis on prevention, we're going to see a lot of rolling back of the incidence rate, which is the rate of new cases that is occurring on the continent of Africa.
And that was AIDS expert Dr. Ernest Darko. Coming up on Inside Africa, breaking with tradition to save his own life. A Kenyan man goes under the knife to reduce his risk of contracting HIV. And an expert explains why World AIDS Day is a time to celebrate in Rwanda. Stay with us.